Hi friends, welcome to my channel Rashmi Jadhav. Here we were going to discuss about the topic specific quantitative designs. In the previous video, we have seen about the non-experimental designs, right? Now let's start. What is specific quantitative design? See, the quantitative studies are broadly classified under true experimental, quasi-experimental and non-experimental research designs. But there are certain categories of research which we differentiate according to the purpose of study. That's why we described it in different categories, right? That is specific quantitative research designs. Okay, the different categories in this design we can see clinical trials, evaluation research, outcome research, operational research, methodological studies, secondary data analysis and meta-analysis, and ecological studies. First we will see clinical trials. Clinical means in the field of medicine. Clinical trial is a type of systematic investigation which we use in the field of medicine to do research on safety and efficacy of new drugs and medical devices in human subjects, right? Here, preclinical testing of drugs or device is done on animals before its clinical trials on the humans. In addition, approval of health authority and institute ethical committee must be obtained before starting the clinical trials. Also, there are different phases in clinical trials: phase 0, phase 1, phase 2, phase 3 and phase 4. In these different phases, we are doing research on the human subjects differently. In phase 0, we are doing research on 10 to 15 human beings, right? In phase 1, we are doing research on 15 to 30 human beings, or 20 to 80 we can take. In phase 2, we are taking 100 human beings as a subject for the research. Like this, we are doing clinical trials. The next is evaluation research. Evaluation research is an applied form of research design in which we do judgment about how well a specific program, practice, procedure or policy is working. Evaluation research helpful for decision makers because they decide whether to adapt, modify or abandon a program, practice, procedure or policy. Evaluation studies also used to determine the effectiveness of any processes, personnel, equipment and the material used in particular program. In the era of evidence-based practice and client-centered care, evaluation research is very important. For example, Sharma carried out an evaluation study on the effectiveness of Anganwadi scheme for the children in selected villages. Right? For this program, we are doing evaluation research. Now, evaluation research is of two types: formative evaluation and summative evaluation. Formative evaluation refers to the assessment of process of ongoing program. It is also known as process or implementation analysis, which provide information about the program, process, how we can implement and how it actually functions, right? And the summative evaluation refers to the outcome of the program that is conducted after the completion of the program. It is also known as outcome analysis, which focuses on whether a program or policy achieved its objectives or not. For example, program is implemented to encourage institutional delivery among the tribal women. In outcome analysis, the investigator collects the data about how many tribal women has institutional delivery after the implementation of this program, right? Next we will see outcome research. What is outcome research? It involves the evaluation of care practices and systems. Outcome research looks like evaluation research, but evaluation research focus on specific new program or policy, whereas outcome research is used globally in nursing or healthcare services. For example, research on effectiveness of quality assurance program implemented in suppose XYZ hospital, right? So, this is we are applying in healthcare programs, right? Next is operational research. Operational research is an advanced level analytical technique in which we make best use of available resources in organization. Operational research is new method of research. It is used in making decisions regarding the operations under control. In this techniques, right, the steps are: first is observe the problem environment in an organization. Second step, analyze and define the problem. Third step, develop a model for this. Fourth step, select appropriate data for the input. Fifth step, select a solution and test it. And sixth is, which we have selected the solution, we have to implement it, right? Next is methodological research. The methodology means method, right? So, here in research we want research tools or scales to do research. How these research tools are created? The answer is through methodological research designs, right? This is used for the developing research tools and evaluation of data collection instruments, scales or techniques. It is also known as psychometrics. This way we develop the instruments for measurement of skills, knowledge, abilities, attitudes, personality traits, educational achievements, disease condition, disorder manifestations, nursing care outcomes and so on. These are variety of instruments and scales we have to develop by the help of methodological research designs, right? In this, steps are: first is formulating the items for the tool. We have to formulate the items, right, for making the tool. Second is developing instruments for users and respondents. Third is, then we have to check the instruments, testing the reliability and validity of research tools, right. For example, a researcher wants to develop assessment tool for assessing level of pain, by which we can check pain level in the patients, right. So, pain level tool we have to develop. Next is secondary data analysis. Secondary data analysis is research design in which the data collected by one researcher is reanalyzed by another researcher. Okay. Usually it is used to test new hypotheses from the old research. Sometimes researcher collects lot of data in the study, out of which some of the data are left unused and unanalyzed that are later utilized by another researcher, which we call secondary data analysis research. These studies are considered as most convenient, time saving and cost effective too, right. Okay, the next is meta-analysis. When we combine multiple research designs and we analyze all and get the outcome for our study. Means in this we do research on multiple research studies which is already done in past, and researcher then do research on all the multiple studies and summarize it and get the final data. Quantitatively combining and integrating the findings of the multiple research studies on a particular topic is known as meta-analysis, right. Next is ecological studies. Ecological studies are epidemiological research designs. This is done in groups rather than individuals. For example, an ecological study of tuberculosis transmission in California. In this study, the investigator collects the case reports of TB cases from Department of Health and their socio-economic data from census and computed the statistical results to find out the association between ecological factors and the rates of tuberculosis within California. Thanks for watching this video. Please like it and subscribe it for more upcoming videos.